Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is an interesting case of inflammatory myofibroblastic tumor of the mesentery in a young child. So this is a 2-year-old female patient who presented with abdominal pelvic mass noted by the mother. And at surgery, she was found to have mesenteric mass. And this is the low power magnification of the mesenteric mass. And as you can see, this is a spindle cell proliferation with some ectatic vessels. It might contain, you might argue that there is some staghorn appearance to the vessels, and then we have a sprinkling of inflammatory cell infiltrate. And at high power magnification, these are the vessels, the dilated vessels, and then the spindle cells showing moderate, I would say, degree of atypia, and then the inflammatory cells at the edges. No mitosis is identified in this field. And another area more cellular in this focus, again, spindle cell proliferation, some atypia, mild to moderate atypia, a single mitotic figure, vessels with staghorn appearance, and plasma cells. Now, other areas showed more fibrosis in the background, and again, the proliferating cells, the myofibroblast, with some abundant acidophilic cytoplasm, vesicular nucleus, and a prominent nucleolus. And we can start to see here clearly the plasma cell component of the inflammatory infiltrate, but again, no mitotic figures, and more of the sclerotic areas and more of the cells, spindle-shaped cells with some degree of pleomorphism with the prominent nucleoli, lots of sclerosis in the background, and then the plasma cells, some of which are binucleate. And another focus where, again, there is this proliferation of the spindle cells in most of the sections that I showed you. There was no evidence of mitosis apart from a single mitotic figure that could be identified, no necrosis, and the pleomorphism was not severe or marked in any of the slides that I shared with you. Now, into the immunohistochemistry, and the smooth muscle actin was focally positive, as was caldesmin, and this would bring into the differential diagnosis myofibroblastic tumors in general, as well as smooth muscle tumors. But really what is striking in this case in particular is the inflammatory infiltrate. Now remember that even nodular fasciitis in a way can enter into the differential diagnosis and can show this pattern of immunostaining. Desmin was completely negative, as was S100, which was completely negative, and CD34 was negative, as was c-KIT immunohistochemistry, to rule out the possibility of just a tumor, which can occur in the mesentery away from the bowel wall itself. And this is the c-KIT. But really what was beautifully positive is the ALK immunohistochemistry, which showed the cytoplasmic staining in the tumor or in the neoplastic cells, robust stain that was very clear. Now, some cases of inflammatory myofibroblast tumors might be associated with EBV infection, and this is the immunohistochemistry, and it was completely negative. Now, ideally, it should have been done with ISH, but at that time, we did not have ISH, and by immunohistochemistry was completely negative. So the final diagnosis of this case, after really obtaining support from the beautiful ALK stain, is inflammatory myofibroblastic tumor of the mesentery. Remember that this tumor can occur in a variety of locations, including in the respiratory tract, in the GI proper, but also a common location is the mesentery. Usually it is considered of undetermined malignant potential. Most of the cases behave in a benign fashion. Some cases might recur, and some cases even might behave more aggressively. Clues to aggressive behavior from the histology include increased cellularity, as well as increased marked pleomorphism, associated with high mitotic figures, usually in the range of 7 per 10 high power fields. The treatment of choice is almost always with surgical resection. Now, some cases which, like in this case, are positive for ALK-immunostain might benefit from ALK inhibitors in controlling the progression of the disease. I hope you find this tip useful in your daily practice. Thank you.